here. Maybe I can give you some aid.
Hello, everybody. Great to see everybody out again this week. Great to see a continuing group of faces. We're all getting to know each other here on the corner of Senator Feinstein's office. I can think of no issue more important than healthcare. No issue more fundamental than healthcare. There's a story that I've told many times about my mom. And it's about Republicans and Democrats, and I apologize to any Republicans here. You do not apply to this story because you're here. But when I kid you not, when I was 5 years old, I asked my mom what the difference between a Republican and a Democrat was. And I have a brother with Down syndrome named Eric. And my mom said, well, you know, the Democrats, they want to make sure that Eric has a good life. And they want to make sure that he's taken care of. They want to make sure that he has quality of life. And the Republicans just want to leave him behind. Now, I used to tell that story because I thought it was funny. It was a little over the top, a little bit of hyperbole from my mom. But I'm afraid with this new alleged health care bill, that's exactly what's happening. We're talking about 24 million people drop from insurance rolls over the next 10 years, at least.
Yeah.
We're talking about the people who are most vulnerable being dropped from the rolls, people who do not have the money to pay, and also I might remind you, when you talk about the draconian slashes in the Medicaid budget, you're talking about major cuts to disabled Americans. You're talking about no more occupational therapy, no more job therapy, worse homes to live in. Now, if that doesn't move you on a compassionate level, that can move you on a purely practical level. Because I know, as someone who helps to take care of my brother, that if someone does not have somewhere to go, if someone does not have somewhere to make their life productive, they will stay home. That means someone has to be their caretaker. That means that's another person taken out of the workforce. And I want to say again, on a purely practical level, let's leave compassion behind for a minute. On a purely practical level, if you refuse to pay for preventative care, then you are going to pay in the emergency rooms 10 times the cost. The biggest myth out there is that if we knock people off the insurance rolls, that they'll no longer exist, that they'll just disappear. That's not true. They still get treated in emergency rooms, they get treated by EMTs, and the cost skyrockets. But let's talk about compassion. Have you no decency, Republicans? Have you no decency? We're talking about health care, which means we're talking about lives. This is a life and death situation. So I want to ask you, are you going to fight for people's lives?
Yeah.
Will you fight with everything you have for people's lives?
Yeah.
Do you believe in health care for all?
Yeah.
We all do. We are here today to say Senator Feinstein and all of our Democratic senators and our brothers and sisters who are Republicans, have you no decency? You must pass a law that will help Americans, that will take care of Americans, that we will all pay into, and that will make us more productive, and that will increase our ability to work and increase our ability to pay taxes. This is not charity. Mr. Ryan, we are not talking about mercy here. We're talking about the American way. We're talking about people who want to work, who want to have productive lives. So don't tell us about mercy. Tell us about health care and access for all. You have offered us a Band-Aid for a car wreck. So it is time, Senator Feinstein and all of those in Congress and even our president, who won't put his name on this, but he'll put his name on anything else he can think of, give us a health care law that serves Americans. Will you fight for health care? Will you fight for American lives? Let's do it. Let's keep fighting. That's the American way.